Hi, my name is Andrew Floeder, and I'm a PhD student at the University of Minnesota School of Public Health. Today, I'm going to be sharing my research focusing on the assessment of chemotherapy drug contamination in occupational settings. In 2020, the American Cancer Society estimated 1.8 million new cases of cancer, an increase of 55% over the last 15 years. Additionally, cancer incidence in dogs is increasing, with 1 in 2 dogs developing cancer. As cancer incidence increases, chemotherapy treatment increases. This correlates with 58 million patient oncology clinic visits in the United States in 2020. These chemotherapy drugs are designed to target fast-growing cells. However, they are unable to exclusively target cancer cells, resulting in the death of healthy, normal cells. Patients who are receiving the benefits of this treatment also see toxic side effects. The question remains, what is the impact of the staff and caregivers inadvertently exposed to these drugs? The health risks of exposure to anti-neoplastic drugs are well established, with cardiac, reproductive, and genotoxic effects seen in chronic exposure. Overall, this scenario may lead to the exposure of numerous patients, nurses, and family members to anti-neoplastic drugs. As previously mentioned, veterinary chemotherapy administration is increasing in oncology clinics. Dogs that are treated with anti-neoplastic drugs may act as a source of secondary exposure, yet this source of contamination and exposure remains to be explored. Our research focused on addressing the question of what are the levels of chemotherapy contamination in veterinary oncology clinics, as well as the patient home environment. We focused on 2 specific aims for this project. Looking at aim 1, our goal is to develop and optimize a liquid chromatography mass spectrometry method for the simultaneous detection of commonly used chemotherapy drugs, and validate said method with laboratory surface wipe sampling. We conducted surface wipe sampling in our lab on stainless steel plates that represent a clinical surface. These samples were then analyzed using our new method that underwent optimization for the column, mobile phases, and injection volume to obtain the limit of detection, quantitation, recovery, and method detection limit. Overall, there was a lot of work that went into the LCMS method and optimization, and I'd be happy to answer any questions. Moving to aim 2, our goal was to apply our new LCMS method to quantify the levels of chemotherapy contamination seen in veterinary oncology clinics. We conducted surface wipe sampling at the University of Minnesota Veterinary Medical Center after dogs received either cyclophosphamide or doxorubicin. Samples were conducted wiping commonly used surfaces in the clinic, which results I'll present on today, as well as ongoing research for this project expanding into wiping dogs 24 hours post-treatment. For cyclophosphamide, we were able to detect this drug on wipe samples in 4 areas of the clinic: the door handle, treatment table, oral drug administration area, and hazardous waste bin lid. This treatment is relatively fast as cyclophosphamide is orally administered. The drug is localized in areas specific towards its preparation and administration. We were also able to detect doxorubicin on wipe samples in all areas of the clinic. Doxorubicin is an IV administration, so it takes longer to complete, ranging from 20 to 40 minutes depending on the dog size. It also travels more around the clinic due to its preparation and administration, so it's found in more areas. This is a visual breakdown of the chemotherapy drug administration room. As you can see, doxorubicin is more so localized on the treatment table and intravenous drug preparation area, as well as cyclophosphamide being more localized towards the oral drug administration area and the treatment table. This breakdown shows that the different types of chemotherapy administration is led to different contamination in the clinic. In conclusion, we were able to develop a sensitive method as a new tool for the identification and quantification of anti-neoplastic drugs. We collected data on the contamination seen in a veterinary oncology clinic, as well as moving on to future research collecting potential second-hand exposure from dogs outside of the occupational environment. This preliminary data is one of the first studies focusing on chemotherapy surface contamination in veterinary oncology clinics. Moving forward, it is important to note that our sampling procedure has little burden on the population. It represents a relatively easy surveillance method with a thorough protocol for the precise identification of chemotherapy contamination. Overall, this reduces the cost and barriers for sampling. This sets the stage for surface wipe sampling to monitor all areas with potential for chemotherapy contamination, as well as then measuring different remediation techniques. Overall, it addresses the growing problem of anti-neoplastic drug contamination outside of occupational settings, with the increasing administration for home chemotherapy treatment. Additionally, we would like to highlight the impact of our research, where we were able to share the results directly with our collaborators at the vet clinics. All of the research was disseminated at group meetings with the oncology workers who may have been directly impacted by the results. This prompted discussions about additional sampling, new strategies to reduce contamination. They provided feedback on research aspects and overall led towards a continuation of our collaboration. I would like to thank all of my collaborators and individuals who helped me participate in this research, as well as the Midwest Center for Occupational Health and Safety for providing the funding that enabled me to complete my pilot project. Thank you.